Hello, my name is Dr.Yash Godbole. I am a consultant urologist, andrologist and a reconstructive urology surgeon. So, बहुत सारी एक common misconceptions है regarding the point of urinary incontinence. Unfortunately, this disease etiology affects women much more than men. The reason being the female tract is only 4 centimeters long and the male is 20 centimeters. Moreover, men have got 2 points to stop urinary leakage: the bladder neck, the prostate, and the external urethral sphincters. Females only have the length of the urethra to stop it and a mucosal apposition. Basically, जब urethra के दो layers एक दूसरे के साथ चिपकते हैं तब urinary continence along with the pelvic floor act to keep the urine inside. So basically, what is urinary incontinence? Urinary incontinence means involuntary loss of urine. यानी जो पेशाब आपके शरीर से निकले बिना आपके कंट्रोल के या आपके नॉलेज के बाहर. So सबसे commonest causes जो फीमेल्स में है that is having multiparity और multiple vaginal deliveries. Obstetric causes where forceful obstetric procedure or maybe some kind of trauma encountered during surgery, and also weakness of the pelvic floor. All these factors together combine leading to a premature opening of the urethra of the female and the bladder neck, which causes the leakage and loss of urine. Most commonest symptoms, so of course without going into too much technicalities, there is urge incontinence and stress incontinence. तो सबसे commonest हम जो encounter करते हैं वो stress incontinence. यानी फीमेल स्लाइटली ओल्डर फीमेल्स आती है और बोलती है कि जब मैं खांसी करती हूँ या जब मैं कुछ हैवी लोड उठाती हूँ तो मेरे कंट्रोल के बाहर पेशाब लीक होती रहती है. दिस इज द मोस्ट कॉमनेस्ट फॉर्म ऑफ रादर प्रेजेंटेशन ऑफ स्ट्रेस यूरिनरी इनकॉन्टिनेंस. सिम्टम्स आर अ कांस्टेंट ड्रिबलिंग सेंसेशन, हमेशा पेशाब के जगह से कपड़े गीले होना, कंट्रोल के बाहर जोर लगे तो पेशाब पूरी होना. These are the most commonest causes and these can be very psychologically traumatic and emotionally scarring, especially for female patients. Unfortunately, most patients in this category are female. So, another second entity we discuss is the urge urinary incontinence, where a patient gets a sudden urge or a sudden feeling to pass urine, पर वो रोक नहीं पाते टॉयलेट तक. So, before they reach the toilet, they leak. This is more common in males who have got large prostate glands which are causing obstruction. So, they present with a certain degree of overactivity of the bladder, a sudden need to pass urine, and before they can reach the toilet, they have soaked their trousers. This can be corrected with medical management or surgical management depending upon the diagnosis and workup of the patient. The basic workup is a ultrasound with post-void residue. This will help us to know whether the bladder is a cause, whether there is a problem at the outlet, and what kind of urine is being left behind in the bladder. Secondly, we may consider doing a uroflowmetry where we can see the pattern of the urinary flow, and in some cases a urodynamic study may be required to see whether the bladder is able to excrete the urine or whether the problem is at the level of the bladder outflow tract. Treatments involve various methods. We can have surgical or medical management. We first try to do a lifestyle and medical management where we ask the patient to consume good amount of fluids. We ask them to space out and time their urinary voids. We advise them to do double voiding, that is to pass urine, take a small break, go pass again. We ask them to maintain a bladder diary to see how much fluid intake they are taking. Sometimes the excess fluid intake is often a culprit. Thereafter, we give them medical management such as pelvic floor therapies, which can be better described by a physiotherapist. Then, in certain cases, we may require to perform surgical interventions. These will be aimed at increasing the outflow resistance. That means we may have to do a sling surgery. We may have to, in severe cases, we may have to insert artificial urinary sphincter. But again, the topic is vast, but this is just the overview of what I can come up with. I will say that yes, lifestyle does make a difference. Consumption of many beverages such as coffee, teas or sugary drinks can increase the amount of urine produced. Certain substances are irritant to the bladder. So if we have a high spice in our diet, so capsaicin, which is a known irritant to the bladder, may cause certain overactive symptoms. And yes, that can affect the patient's urinary pathway. So to sum up, don't be shy. If you have urinary incontinence, don't keep it to yourself. You have a right to live well, live happily and live normally. Please seek help from your nearest urologist and don't suffer in silence, because it can be suffering and it can be traumatic to the patient who has incontinence. No one likes to live with it. Please seek help, and there are many treatments available for it today.